Bismillahirrahmanirrahim. My dear students, today we'll discuss the topic of electrocution and death due to electrocution. When electric current passes through human body, it can produce various effects. At times there is insignificant localized muscle spasm only. At times there is little or no contact burns, but in some situations instant death of the person can occur with no external lesion, no burns, and in some conditions there may be extremely severe burning and death may not occur. We will study the topic under various headings. First, its legal importance, then few electrical considerations, modes of death in such cases, recognition of electrical lesion at autopsy, then medico-legal aspects. In most of the cases, it is accidental death. Rarely it is suicidal and homicidal. In few countries of the world, convicts are executed through electrocution. This is called judicial electrocution. Then we will also deal with lightning, death due to lightning, manifestations of lightning, and lightning syndrome. We will take these one by one. First, legal importance. In industrial situations, electrocution can occur. Similarly, a water lineman working with high voltage wires can face electrocution accidentally. In such situations, compensation has to be paid to the victim if he survives and to the relatives of the person who is dead, who dies under these circumstances. If electrocution occurs in domestic situation inside the house, we have to rule out the foul play. Then iatrogenic electrocution. Iatrogenic electrocution means during various medical procedures electricity is used, and if there is element of medical negligence, it can lead to electrocution, and then again compensation has to be paid to the victim or to his relatives. Electrical considerations. At times you get question in UHS exam, what are various factors which determine that a particular incident of electrocution is going to be fatal or otherwise. We have to take into consideration many factors. First one is voltage of the electricity. In domestic situation, 220 to 240 volt of electricity are used, and if electrocution occurs, death can occur, and there is at times hold on phenomena, at times electricity throws the person away, what we call throw off phenomena. In industrial situations, 600 to 1200 volts of electricity are used, and they are also quite hazardous. Natural electricity, lightning. In lightning, millions of volts electricity travels from the sky towards the ground, towards the earth, and it is of DC type. This is Wabda lineman working with high voltage wire. He can come across accidental electrocution and then compensation has to be paid. Second factor is amperage of the current, the strength of the current. There is a formula, A is equal to VR. Amperage is equal to voltage multiplied by resistance. Voltage is multiplied by resistance, and unit of resistance is ohms, as you know. If 1 milliampere current enters the body, it will only produce tingling sensations. If more than 1 milliampere is introduced inside the body, up to 10 milliampere, there will be painful sensations and hold on phenomena. Hold on phenomena means muscles of the body go into spasm and the person is unable to get away, and we say बिजली ने पकड़ लिया है. इनफैक्ट बिजली पकड़ती नहीं है, हमारे अपने मसल्स स्पैज्म में चले जाते हैं. When 100 milliamperes current enters the body, it can lead to ventricular fibrillation and death. And at times the death occurs due to spasm of respiratory muscles, leading to asphyxial death. Third factor is nature of current. Alternating current or direct current. It is said that alternating current is more dangerous than the DC type of current. Next factor is resistance of the tissues. Resistance of the body tissues. It varies in various body tissues. Dry skin offers thousands and lakhs of ohms of resistance, but wet skin offers only 300 ohms of resistance. Body fluids like blood, they offer least resistance, and resistance offered by bone, fat, nerve, muscle falls in between these two extremes. Next factor is duration of contact. If duration of contact is more, it is more likely that the outcome will be fatal. There may be hold-on effect. The body muscles may go into spasm and one cannot get away from the electric current and can die. At times, when there is high voltage, person is thrown away, and in such cases he may fall from height and sustain injuries due to fall. There can also be arcing effect. At times in the exam, examiner asks you what is arcing phenomena or arcing effect related with electrocution. Around all high voltage wires up to 33,000 voltage wires. Some electrical activity is going on around these wires, and if some human being or some bird goes close to these wires, he can get electrocuted without even touching the wires. So this phenomena in which a human being or a bird is electrocuted without even touching the wires is called arcing effect, because electrical activity is going on around the wires up to few centimeters. Next factor is pathway of the current in the body. This also determines the outcome. If entry of electricity is from right shoulder and exit is from left foot, then heart may come in between and it is quite fatal. If entry is from one foot and exit is from other foot, it may not be that fatal. Earthing also determines the outcome. Preparedness for shock. These electricians who are in habit of working with electricity, they always anticipate shock. So they are prepared to receive electric shock throughout the time they are working, and in these individuals the outcome is not fatal even if they are electrocuted. Similarly, disease, if person is suffering from cardiac disease, he is more likely to die due to electrocution. And another factor can be sleep. Person is sleeping and he is getting electrocuted. He cannot get away from this. Traceless passing of current through the body. You will find no lesion on the body in such cases. Few prerequisite conditions are required for this. Resistance should be very, very less. Resistance of the body. The density of the current is low. Strength of the current is less. Electrode is broad. And the duration of contact is less. This is an ideal situation in bathroom when person is taking bath in bathtub and he gets electrocuted. Traceless passing of current through the body. Mechanism of death. Death can occur due to ventricular fibrillation. Another cause of death may be respiratory arrest. The cerebral anoxia can lead to death, and when spasm of the respiratory muscles occurs, death will be due to tetanic asphyxia, lack of oxygen inside the lungs. Medical-legal aspects, in almost 90% of the cases, it is accidental. Suicidal and homicidal are quite uncommon, but in few countries of the world, convicts are executed through electrocution called judicial electrocution. This is the chair which is used for this purpose. The person is made to sit in the chair. His head is shaved off, one electrode is applied on the head, other on the leg, and a current of 7.5 amperes strength 2000 volts is passed through the body. It is of AC type and it is passed through the body for 1 minute. The temperature of the body is raised up to 114 degree Fahrenheit. If death does not occur, the process is repeated. This is how convicts are electrocuted to death in few countries of the world. Autopsy in such cases. Autopsy in cases of death due to electrocution. Circumstantial evidence is very important. Then one should be able to recognize the electrical lesion on autopsy examination. If there is firm contact, there may be blister on the fingers containing fluid and gas. If the contact is loose, we may have typical electrical lesion, which is a depressed area surrounded by yellow colored area surrounded by red area. Effects of burns must be recognized on autopsy examination, and if other injuries are present, they should also be noted and recorded. We may have non-specific findings when death occurs due to spasm of respiratory muscles leading to asphyxia. We will find asphyxial findings inside the body. Now there is a term iatrogenic electrocution. When electrocution is done by the medical people while doing certain procedures on the patients. For example, electrocution occurring when electrical equipments are applied to the body of the patient, for example, in electroconvulsive therapy. Very strong current is used for this purpose. Similarly, while doing electrical cauterization, up to 40,000 volts of electricity are used, and also in diathermy. Accidental electrocution can occur during these procedures, and then the person or his relatives have to be paid compensation. Death occurs due to ventricular fibrillation in these cases. Now we'll deal with lightning and death due to lightning. When lightning occurs, millions of voltage of DC type current, electricity travels from the clouds towards the earth. In lightning stroke, very high voltage of current passes through the body, and findings on autopsy examination are also due to the accompanying blast wave. There is a history of recent occurrence of thunderstorm or lightning storm in that area. If you examine the clothes, they may be completely torn off, shoes and belt are burst open due to the effect of blast wave. and at times there may not be any other finding, any other injury on the body except a small entry hole, and some other times you may find extremely disruptive type of findings, extensive mutilation of the dead body. Dead body is badly affected. Like lightning. In lightning stroke, when high voltage current passes through the body, you may have different types of burns. Surface burns, linear burns, and arborescent burns. Arborescent burns are the burns which have the fashion pattern like that of branches of tree. During this stroke, metallic objects present on the body like key ring, watch, they get magnetized. It is said that survival rate of victims of lightning is quite good. In one study, it was found out that out of 250, 250 out of 601 survived. Autopsy in such cases is done to rule out homicide and foul play. Circumstantial evidence and magnetization of the metallic objects help to decide the issue. This is arborescent pattern, surface burns present on the back of the individual due to lightning. The pattern is like that of branches of tree. It is classical arborescent burn of lightning. Well, we stop here. Thank you very much.